Yes, you are welcome to the first discussion segment on nationalism and you, and we are still on your flagship program this morning on ITV. We're going to be taking a look at PCR COVID-19 test for travelers. Many Nigerians have expressed their frustrations, and some have even described it as a fraud. No other person described it as a fraud. Or probably it wouldn't have been more heavier in the mouth of another person than the country representative of World Health Organization, Ayoade Alakija. She visibly called for the probing of Ministry of Health and NCDC. So we are going to be taking a look at this issue this morning on nationalism and you. I remain your host, Ebenezer Oyetakin, and with me to take a look at this morning is Dr. Okoroafo.
Welcome.
And I say to you, nationalism and you.
It is my duty and responsibility to build a new Nigeria.
Your duty, my duty, our duty to build a new Nigeria. Very well.
Yeah.
Have you come in contact with this COVID-19 test?
Yeah, I would say...
At the airport, have you had any experience
yes,
of
I would say indirectly, in the sense that over the COVID time, a lot of my people were stranded all over the world, and some of them had to come back. And over some of my children and nieces had to go back to where they study outside the country. Now, it is really very frustrating, in the sense that people will come back and they are expected to do 2 tests, and some of the tests they've been carried out, it's very exorbitant prices. And also not just the frustration of trying to go back to be able to get the test done, especially those who are going back to America. They say a day before you go back, and also pre-departure, you have to book for you pay over. When you go back there, you do the 2-day test and the 8-day test. Now the whole thing was just sounding as if it's a mechanism to siphon from people from the diaspora and also anybody who wants to leave the country, and that's the way it appears to me.
The most frustrating things that many Nigerians express their concern about, which I think was a bit addressed by the Secretary to the Government of the Federation, is the issue of you are fully vaccinated and you got to the airport, like Nadia Zikwe
Yes.
Airport. I experienced that personally. I got to that airport with my fully vaccinated card, and they pushed the card away. They didn't even look at it. They don't care. They don't give a hoot that you are fully vaccinated and things of that.
In October 11, 2021, the British government, the British Council or the British Embassy said that those who are vaccinated with the approved kind of vaccine are not supposed to do pre-departure vaccine before you leave. But the only thing is that wherever you get to your country of destination, you go for 2 days test and the 8-day test, and you isolate yourself for 10 days. But there's a problem here. Now, because of the fraud nature of our primary healthcare, the primary healthcare development agencies that were designated to carry out these PCR tests or viral tests, we were occasions where people go here and buy those tips and buy those cards, those codes, and go to country destination, and still they are not vaccinated. So the issue is when the system begin to go bad and people are not respecting the veracity of whatever test you conduct in Nigeria, it's becoming a source of concern. Because if you remember what happened during the Omicron time, that 2 Nigerians had to travel to Canada to be tested to have gotten it, and they did their pre-test here in Nigeria. So the issue is not about the test, but also the veracity of those people, those primary health care development agencies that were assigned to do the test. So there's a call for question. In fact, World Health Organization were putting question marks and beginning to check whether our CDC were really checkmating these agencies that were given to carry out these tests.
One of the frustrating things that the Nigerians are complaining about is that this COVID-19 test this PCR result test is supposed to be as costly as it is. For Abuja here, 39,500. For Lagos, between 50,000, 60,000. And the funniest thing was that I traveled out of the country. I paid the 39,500. I got the PCR test result on me. I arrived the country of destination. They looked at it and they allowed me into the country. They didn't test me anything and the rest of it. They only told me, when you want to return to Nigeria, you will conduct another test, which I did. But I conducted that test over there, about 24 hours to come in here, arriving here, showing them the test, doesn't matter to them. You have to pay another 39,000. And when I told them I am fully vaccinated, they said to me, because they go and bring your card, and I brought my card that they dispatched when I was traveling out. I brought the card and they fixed it on the machine and said you are fully vaccinated. But because you are fully vaccinated, you will still pay the 39,500. That if you were not vaccinated or halfly vaccinated, you would have paid 89,000. We are saying, is this a market trading on our people's tragedy? That is what Nigerians are asking.
You see, when I was talking to some of my friends, I was telling them that I see a clandestine plan by the big farm companies, and also see third world countries collaborating. I don't know what the plan is, but I see rather than trying to pursue, vaccinate, rather to prevent the spread of COVID-19, but rather as an avenue for money making. It also happened in the HIV stuff. Those days I used to call it a HIV sector, because it was a time where people want to make money. The idea of the whole policy, or the vaccination and the control for the spread of COVID, was to contain the contagious contagion. But what I see today is that some of these agencies that are responsible for the vaccination, the implementations, are just that it's a money spinning industry for some group of people. And I think there's a time for our CDC to look into it, to see what is the aim. Because the pressure and the frustration people get, that will make somebody to go to a place and not vaccinated and get a card. Because people are willing to sell. Because of all the pressure, or also lie. So if you make it, the concern is not actually paying the money and getting all those things, but rather to see that it's either you are vaccinated, or it's either you do the test before leaving or departing to any country, or before you enter Nigeria, you have done the test or you are vaccinated. I think that should be the priority. I think we are missing it because of the money that is involved.
Many Nigerians also said that returning to the country, they will be so drilled. Some of them will be delayed for almost about 4 hours. Like me, I was delayed for 4 hours to enter my own country. Then, the moment you pay the money, either 39 or 89,000, that is 39,500 if you are vaccinated, 89,000 if you are not vaccinated, and things of that nature. Then, the moment you pay that money, nobody follow you up any longer, whether you even go for the test or not, and things of that nature.
Or even go for isolation.
Yes. So, we are saying that, is it about the money or about the preventive measure, actually?
You see, I remember very well my niece who traveled, he had to fill a location form. I think I was already vaccinated, and she was also supposed to fill a location form. A location form to tell the country where she will be, places she will go, and I tell you, they were monitoring, and she was reporting that outside the country. Okay. Now, you see, the biggest problem we are facing is that larger percentage of our economy, you know me, I like talking about the economy too, is a diaspora return. Now, a situation where a group of people who have stayed overseas, who have made so much, and the dollar that is in scarcity, they bring what called diaspora return. Nigeria depends largely on diaspora return. If they check in the index how much came in from our people who have traveled to other countries and the amount of money they brought in, you understand that it's also part of source of income for the country. Then when you have a border gate that check these vaccines, that frustrates people, that I want to go back to my own country. In fact, if I go to the destination country, once I show them, they allow me, and the ease at which those things are done is very convenient. And I'll come back to my own country. I have to stay 6 hours 4 hours just to get, and there's some things that should be waived, and I have to pay for it. I know it is frustrating, and it doesn't give a good, very good report about our country.
Do you know even some officers, immigration officers, custom officers that are at the airport, they felt the frustrations of Nigerians. They were telling me, Oga, even if you are coming back and the rest of it, you may have to pay 89,000 before you enter, and the rest of it, and that kind of thing. And that was visited on me, actually. They said, please, if you people know how to expose this and that kind of a thing. Now, that being that, let us take a look at our statistic compared to United States and others. The fatality rate, the numbers of deaths in United States was 967,000 people killed by COVID-19. In France, it was 137,000. In United Kingdom, 163,000. In Germany, 124,000. In Turkey, 96,000. All these countries have evacuated, and they no longer even expect you to run the test, the PCR test any longer. They have evacuated all those stringent conditions and things of that nature. Nigeria was said to have had a fatality rate of 3,142. Why is our own continue to be so ardently pursued as if we are the most killed by COVID-19? That is what Nigerians are feeling the frustration, are asking.
I said something so many years ago. I said, a life not well, I think it's Aristotle that said that a life not well examined is not worth living. We have not, as a people, defined who we are. We are not, as a people, have a policy trust of what we want. You see, if anything happened in the world, it's like if they sing somewhere in the world, then we catch cold here in Nigeria. The same thing happening today. Though, thank God that I wouldn't say thank God, but I would say that even the Ukraine and Russian war has taken the shine of the COVID propaganda. And I tell you that even now that there's Ukraine and Russian war, Nigeria is still talking about it, how it's affecting wheat and bread. And Nigeria is still talking about how it's affecting the fuel scarcity, the queuing up and down. So you see, Nigeria is an interesting place where every international event has its own consequence in Nigeria, even if we are not well affected. Why? Because you see, people are looking for reasons. People are looking for reasons why they can do things, create crisis, create confusion to siphon money. I say it without taking back my word. What I'm saying is that if you stay and see how people give excuses. The COVID, I know that now in UK, the restrictions is like lowered. You can enter and go, but we are still keeping it because somebody is. Last time I came here, we talked about stamp duty. What has been done about it?
Nothing.
So I can call it on and on and on. There's so many things going. Okay, there's some countries where yellow fever does not go, but they still insist on it. So many things are still going on. In fact, some people will say, there's the UN World Health has said there's no more polio in Nigeria. But somebody will want to go and create it because it is his livelihood. So the fuel scarcity you are seeing today, some people, millionaires, have been made out of it. So anything you see that is not working very well, somebody is making profit from it. And that's why it's being perpetuated, and that's the reason.
Do you support the call of the World Health Organization Special Envoy, Ayode Alakija, for the probe of NCDC over these agitations of Nigerians and their frustrations regarding this COVID-19 and the expensive nature of it? She's actually calling for the probing of Ministry of Health and NCDC. That was audacious. Definitely,
that is what should be done. But I will, sorry to disappoint everybody, nothing will happen. Because if you dig through the layers, separate layers, you discover that the people that are involved.
Because after the special envoy of the World Health Organization raised his own alarm concerning this issue and called for the probe of Ministry of Health and NCDC about 2 days ago, and also we made a broadcast about it, about our experiences and the rest of it, and the cry of Nigerians in the international airport. It was really frustrating. So, Mr. Ifedayo Adetifa, who is the DG, the current DG of the NCDC, said, we will never stop the test and the rest of it and that kind of a thing. Nigerians are saying that, is it not appropriate for either the Minister of Health or Mr. Ifedayo, the DG, to address Nigerians, number one point, why the so much expenses, why the expensiveness, then what entails that is making the whole thing so rigorous and that kind of, are they not supposed to talk to Nigerians about this?
Before I address that issue, let me just give you some examples so that you understand what we're talking about. We have a moribund monument called NNPC refineries, about 4 of them. People work there. We do turnaround maintenance for the last, how many donkey years?
Going to 25
yes.
years.
And budgets, and it's not producing 1 liter. And nobody's talking. We have a Jokuta, who's also another monument. It's a museum. So it's a motif. It's a recurrent motif, contiguous. I can name them from one state to another, that we are servicing and nothing is happening and nobody is raising eyelid. So when the DG came up and saying we must continue, it is part of the pipeline we're talking about. Pipeline that sustain some fattened cows. So the issue is for a conscious citizenship, not an idiot citizen. When I mean the Greek way of saying people, a citizen that is conscious of what goes on. Until a citizen begin to hold people accountable. If we continue to say it doesn't concern me, let them, it's their turn, our turn is coming, then we will continue this way.
About 2 days ago, the response of the federal government, and Nigerians almost wanted to celebrate it until when they went to read the content of the response of the government to the alarm raised by the various sectors, televisions, houses, Nigerian civil societies, and the rest of it. The response of the federal government was that for people who are fully vaccinated, they said the president suspend. They said the federal government have suspended the PCR
test for vaccinated,
pre-inboard, those kind of things.
Yeah.
And Nigerians were so excited until they went to read the major content. So the major content states that is by Boss Mustafa now, Secretary to the Federal Government of Nigeria, and you know he's the chairman of the COVID-19, all of it, said, if you are fully vaccinated, you will no longer be requested to conduct that test. And when you are coming back, you will only be tested free of charge at the airport. And that free of charge testing and the rest of it mechanism will take place from, we commences from April.
Yeah.
Not now. Now, he was very silent about the expensiveness, the cost, and all of that, the delay, and why were there no testing centers right at the airport there, as it were in some of the airports that we visited when we traveled out, till now. And the issue that Nigeria raised, that many government officials are linked with these testing centers and things of that nature, because the enthusiasm with which they push people to them and things of that nature. Yeah. So, taking this into consideration, do you think the federal government have actually addressed the concern and fear of Nigeria?
You know, I'm also a student of public relations and journalism, so I know what we call spinning, and sometimes there are layers in messages. You know, there are times you need to say something and say nothing, but you have said something. No, I think the federal government came up because of these agitations and every media house challenges, and they had to say something. And at the end of the day, they've not said anything. Because even in that April, you'll be shocked that in April, the cost will still be on the individual who is conducting that test.
And the machine to test may not even be in the airport.
So what they will ask you to do, go and pay. There's somebody maybe outside the airport, they'll be collecting revenue for that person. So the issue is, when they set up their apparatus to siphon or to do whatever, they go at all lengths, and they don't hold back. So this is the problem we are having, and this is what I have been saying, that the country needs sometimes to do, sometimes to be able to be conscious and say, we don't want this thing. Not like the way we are doing it, but actually confront this thing, engage some of these people to come up and tell us, when, okay, like the communication the Secretary of the Government gave, we need to see how, because a normal communique is that when you are addressing the press, the journalists ask questions. So if there's journalists and you have made your statement, they should ask you, who bears the cost? Say it's free. How? Because we don't have testing kits at the airport. So how will you release somebody to enter? These are the questions we need. What is the logistic? What are the protocols? But nobody asked that question, and the communication has been given. And if you think, everybody will say the government has responded to that issue. But the problem is still there.
The problem is still there.
Yeah.
Going further, what is the right approach to contain? Because one of the issues that Nigerians are raising is that for the, even on the, you know, they normally run these COVID-19 infection rates.
Yeah.
For Lagos, for Abuja,
Yeah,
for Kano, and for other states. For more than 2 weeks now, going to 2 weeks, it has not been run on any television. So people are saying that if you have stopped releasing the infectionary rate and things of that nature, is it still so valid that we will be pursuing this running of a test in a business racketeering manner with the ferocity of our hyenas? That is what Nigerians are saying.
You see, the philosophy in which, or the policy trust in which we try to contend with the COVID-19 and our response, the philosophy behind underpinning our response to COVID testing and also vaccination, I rather found it faulty. I think I mentioned it somewhere in some writings. But you see, look at the South African approach. While they depend on, okay, the first immediate response from the donations they got, they also start thinking homegrown preventive measures, like the Madagascar experience. Now, because of, they are looking at it, this is about economy. This is about business. The PCR and the kits they are using, are we producing it in Nigeria? Some of these things, yes, were donation, but some of these things were also bought by private concern. So they have to sell it off, and it had an expiring date. So these are the things I want you to understand. So, but in the other part of the world, people are looking at homegrown, going with the intelligentsia.
Even the president called for homegrown approach to tackling.
Yes, this thing. Yes. Because if I think it will be less expensive if the philosophy was homegrown, trying to go to the university, trying to look at College of Education, College of Medicines, bringing out or finding or research, health research institutes like in Voma, quite a number of other parts of the country, like Kwara State and other, growing our own. I feel it will be cheaper. And we might even find a lasting solution to export out of this country, also benefit from the market share. Because to me, it's a business. So at the end of the day, we are retailers for other countries who have hazard the vaccine, who produce these kits for the VCR test and other things, other part of it that because if one bank can even give loan for the manufacturing of those things, country can get it. It's an employment for our people to be able to manufacture those things in great quantity to export. So the issue that we didn't cash in with a better philosophy. So we're in here. It's like you collected things to sell for somebody and the thing has an expiry date. So you will do any government coercion every way, because it's also part of it to see that these things are so. Because don't forget, while the AstraZeneca vaccine was said to be begun to expire. Yes. So you could understand the frustration of people who are waiting to cash out, that the thing is expiring and some of them are being taken off. So they are not making what they're supposed to make.
Now this outcry of Nigerians is very loud.
Yes.
And World Health Organization is in positions to know whether the test we are carrying out is outrageously expensive or not expensive. Because I can't reconcile, if you are fully vaccinated, you pay 39,500, and if you are in Lagos, you pay 50 to 60,000, and if you are not vaccinated, you pay 100,000 in Lagos, and you pay 89,000 and 90,000 in Abuja, and the rest of it. And World Health Organization representative for Nigeria is saying it is too expensive.
Yes.
Who is to be held responsible for this?
I think the
someone should be holding.
Yes, the World Health, if the representative of Nigeria in World Health is raising the alarm, then it's like they are not because the idea for the vaccination and the prevention of COVID is to see that we contend with the COVID, not to make money. And I think that's where we got it wrong. And I think it's the psychic of the Nigerian administration or whatever people in charge and the people who are running the policy are looking at the fund rather than the prevention. Because I don't see, because if you look at the statistics of death, of the death rate, we're well better than so many countries that even have relaxed some of these protocols. But we're still keeping that apparatus or these protocols because somebody has to make returns. And that is the issue. Until we it's about people. It's about prevention. It's about securing the country. It's about the security of the country. Then it is not just making money or making money for some people in the country. And that's why I will put the blame squarely on the policy makers and people who are carrying out the policy.
Going forward, what is the way out of all of this? What is the way out for all of this?
I think that the country should redesign the philosophy on how we attack or how we go on in such a situation of a global pandemic or a global events in the world. You see, if you go to America, there's what we call the Kissinger policy. And the Kissinger policy is a policy document that every American president, no matter how, whether a Democrat or a Republican, will deal with Africa based on Kissinger policy. And quite a number of the Middle East, they have policy on the Middle East, they have policy of every part of the world.
So we should have our own policy.
We should have our policy on how we react to events. And if you want us to come up with a policy, we have the intelligence. And we have people who can do it. We should look at how does it influence, how does it benefit us? Like Donald Trump will say in America.
For example, I remember vividly, let me cut you in. I remember vividly when this COVID-19 was ravaging nations, Italy and all of them. One of the countries it ravaged was Islamic Republic of Iran. Do you know, despite that, when the United States produced the what do you call it, the jabs and all of it, the tests,
Madonna arrest.
The Iranian nation boldly rejected it and produced their own because they said that we don't want to make our citizens the victims of an empire that doesn't like us. Where is the place of Nigeria within this?
Because you see, there's the war called economic mafias, and they call it economic war. It is, you don't even know that some of these things they send to you, probably you cannot attest that these are not trial vaccines that probably once they have sent to see how it will work on the black race. So until you begin to do inward policy, because everything is about how does it affect an African? How do you know? Every part of Africa was looking up to Nigeria to do something, to come up with a document. Okay, we have the intelligentsia, we have professors in medicine. In fact, it will shock you that the guy who produced that vaccine for America is a Nigerian Benin trained doctor who had those things in America, who finally produced the first vaccine during Trump's time. So you can imagine, it is shocking that in our own time, when we have all this brain, God has blessed us with beautiful minds, that if a policy was directed to us, okay, how do we homegrown? You know, there was that time I was talking about even the Madagascar experience. Is there anything we can go and look from the Madagascar experience? Because they have a tree, a particular part of tree that helped slow down the death rate. Because at a point, nobody in Madagascar was infected of COVID until lately the thing started ravaging too.
Seems they killed that one with a conspiracy.
Yes, so even the World Bank was even going to do accreditation to see whether the local one. I remember some countries were already buying from them, like Gambia and the rest were importing the one they made, locally made. So the issue is, it is economy. It's all about the economy of the world. How do you take share in anything that happens? So if you have a homegrown philosophy that our people first, like you said, the Iranians, how can I go and buy a vaccine made by my enemy? So if my enemy can make that vaccine, why can't I make my own vaccine?
And they did.
Yeah, they did. So if we say, okay, the vaccine will not suit a black man, so and all the black Africans are looking up to Nigeria to stand up as the giant of Africa, we brought a vaccine because there were people here and there making postulation. All we needed, so bring them, let's look at it and come up with something. We wouldn't have gone through all this route. People will not waste all this money.
One very painful expression that a particular Nigerian made at the airport, at that particular center, because the NCDC set up a very big center in the heart of the Nigerian airport where this money racketeering and the rest of it was going on for the so-called test, 39,589.90. And one Nigerian came up and said, what I see in this place is simply a fraud.
Yes.
A racketeering. He said, and we are blaming our children that are running after Yahoo, our children that are going into ritualistic practices for money. Are we not sure that we are the one who created the environment and the rest? That word so pained me when he expressed it. But taking a look at it, does money supposed to be defining how we relate with people and the rest of it?
We lost it.
And what is the implication when all we see is money rather than service?
We lost it in the late 80s during the military government. I can remember very well from where I come from. When you talk about people, you look at the integrity, their records, what they have achieved, and their track record. People might have served in civil service, they don't have money. They were permanent secretaries. They were people who made indelible marks in the history, probably in the state or in the federal, and they are given quite a number of respect. But I see when dollarization and everything was all about money in Nigeria, and a lot of people can do anything and get away with it because they have so much money. And it has gone on to this point where I think we worship money now, as in anything is all about money. Look at our political parties. Somebody who wants to be a president, look at the amount of money they are trying to say you must pay to get a form to represent a political party. Look at the campaign. We don't even regulate the amount you spend on campaign. Look at every other thing, even the kind of vehicles we drive, and the kind of we have our own vehicles in Nigeria, but everybody wants to buy even the clothing and everything. It's all about money. If you see young men, none of them want to go and be a scientist. Everybody wants to be a musician, because it is when you are a musician you make so much money and you can go to a party and be spraying dollars. When you want to bury your mother, your grandmother, instead of it be a sober moment, you call all your friends all the while. They're slaughtering cows, they are throwing money up and down, throwing currencies everywhere, and that is what people are liking. Everybody's gravitating towards that, rather than people celebrating people who have made research indelible. Look, when last did Nigeria win a Nobel Peace Prize? When has last Nigeria produced anything reasonable that the world celebrates? But what do we celebrate? We celebrate money and we worship it. And when it's all about money, not people, not service, this is what will happen. Because it's like the Yahoo thing you are talking about is the example we show them. When they can't get it from government, they go anywhere to get it. Because it's about who has money that people listen to.
If you have to advise, we are rounding up this segment, if you have to advise, based on the agitations of Nigerians and the call by the World Health Organization's country representative or country envoy, that the Ministry of Health and the NCDC should be probed over these frustrations that the Nigerian people are agitating over and concerned about, what would be your advice to those who are manning the front of the management of our COVID-19?
I think they should begin to dismantle their apparatus and structures. They should begin to...
But they must prevent further spread. Anyway.
That is definite, but it is not about the money. That's what we're saying. It's a prevention we are looking at. So that's why I've always insisted that the philosophy should be, how do we homegrown our own? It's like 2 years, 3 years. This pandemic, people in China was the first hit. within that 6 months, they were able to hazard a vaccine.
China is not even talking about it anymore.
So it came from China, and they were able to take it off, and they are not talking about it anymore. So we that are just how many percent of our people were killed? All we need to do is to look for a way.
And it seems that President Putin has bombed Boko Haram, bombed COVID-19.
It's gone. And it's like Ukraine war and Russia war taking over the scene. No news.
Thank you very much. It's been wonderful talking to you. We can go on and on.
And on. Thank you.
Let us prevent the frustrations of our people. Let us make our people to have ardent spirit of nationalism, patriotism, and concerns for this country. If you frustrate them going out and you frustrate them coming in, you are getting rid of the spirit of patriotism in them. Let us behave and appreciate humanism beyond materialism. This is the message that we are pushing out. And whomsoever is the authority that is concerned regarding this hula baloo about COVID-19 test and so-called racketeering and fraud at the international entry point, let the authority be alive to their duties and responsibility. Our people are our assets.
Yep.
It's been wonderful talking to you, Dr. Okorafor, and we hope that when we have opportunity to beckon on you, again, you will make yourself available. Still on nationalism, and you, we draw the curtain on this first segment, and we will be back. Don't change the channel.